Hello, and thank you for joining us today for our webinar, A Guide for Reopening Financial Institutions, prepared for you by Compliance Alliance. My name is Elizabeth Madlam, and I am Associate General Counsel with Compliance Alliance. And for those of you who are not familiar with our services, we are an industry leader in all-inclusive compliance advisory service that is owned and operated by state bankers associations. With over 1,700 downloadable tools, banking compliance products for every department, we offer bank compliance resources and guidance for all of your bank functions and regulations. It's my pleasure to be here with you today, and I hope that this webinar provides you with added value in your response efforts to COVID-19. My goal of today's presentation is to provide you a comprehensive overview of the federal considerations your organizations must be reviewing and implementing into your reopening plans, as well as industry best practices when it comes to banking in a post-COVID-19 environment. We will be covering a breakdown of the COVID-19 pandemic, the White House guidelines for reopening America. I'll also be discussing the elements of preparing for your new normal, and we'll go over some key federal guidance considerations for reopening. And then lastly, we will finish with other considerations the bank should be taking in regard to COVID-19 banking. I hope to provide you with tools on how to identify and quantify and manage risks associated with reopening your branches, as well as a discussion on what anticipated shifts or changes in bank objectives you should be considering as this post-pandemic world becomes more and more the new norm. Compliance Alliance has prepared for you two tools that will be included with this webinar for your review. One is a reopening checklist, and the other is a cheat sheet that's offering guidance and a high-level breakdown of the requirements and considerations to review pre- and post-reopening of your branches or of extending your services. And of course, please, at the end of this webinar, if you do have any additional questions, do not hesitate to contact me. My information is going to be found on the very last slide. I do want to start this presentation off with a brief disclaimer. This webinar is not intended as legal or tax advice, nor is it going to be all-inclusive. It is addressing general risks, issues, and anticipated responses that financial institutions should be considering and implementing when beginning to reopen your branches or extend your current services. Because this is a rapidly changing environment, all of the information presented is accurate as of today, so keep in mind information may become inaccurate as more regulatory guidance unfolds. Any definitive guidance must be coming from the federal government, your primary governmental regulator, along with other state and local governmental or organizational entities as applicable. And of course, I would refer you to Compliance Alliance's Pandemic Toolkit, which is open to members and non-members during these times. And it offers additional websites, up-to-the-minute guidance updates, and over 40 tools, cheat sheets, and summaries prepared directly in response to the changes because of COVID-19 banking during this pandemic. Now, the coronavirus or COVID-19 has hit everyone in some capacity, and no one is immune. The novel virus, which began in Wuhan, China back in December, has expanded to nearly every corner of the globe, with hundreds of thousands of people around the world being sickened or worse, death. The World Health Organization declared this virus a global emergency and rated COVID-19's global outbreak impact as very high, which is the most serious designation the organization gives. The first confirmed case in the United States may have been as early as January 21st, but only in the 6th time in the history of the World Health Organization have they declared a public health emergency of international concern. I am actually just outside of Ground Zero, where the first U.S. citizen succumbed to the virus. I'm just outside of Washington, Seattle, Washington, and this was back in February. So, this has been going on for quite some time and has impacted everyone. The CDC issued guidance allowing testing without restrictions, and then shortly later, President Trump declared a U.S. national emergency, opening up $50 billion in federal funding to fight COVID-19. The CDC warned against holding or attending gatherings larger than 50 people, and states began their shelter-in-place orders. Citizens and industries were divided into essential and non-essential capacities, and life has quickly changed to one of social distancing. Millions of Americans are deemed essential workers, putting themselves at risk in order to keep society moving forward, or at best from standing still. Others can work remotely with minimal inconvenience or fear, and then there are those, particularly industry workers and lower middle class, who have been drawn the cards of layoffs or furloughs. Great Depression level unemployment is no longer black and white photos of a bygone era. We are facing this in full HD resolution. It's not a weak economy that was causing unemployment. COVID forced closure of restaurants and hospitality industries, service industries, and other professions that require close personal contact. As of a few days ago, the US unemployment rate has soared to 14.7%, and that's the worst since the Great Depression, as businesses shut down or severely are curtailing their operations to try to limit the spread of this deadly virus. As we slowly enter into our new normal of rebuilding and living within a COVID-19 environment, it's important to understand that your organizations are being flooded with risks right now. Lending during a pandemic-fueled economic environment poses unique risks and considerations for financial institutions. Not only do financial institutions need to have a demonstrated pandemic preparedness plan in place that is activated and working, you need to be resilient to market volatility, technological threats, regulatory compliance and operations challenges, particularly with a dramatic shift to remote employees. And now you have considerations regarding reopening and delegating of responsibilities of social safe distance practicing while expanding or reopening completely to services your communities with employee safeness. Now, President Trump has unveiled the national guidelines for reopening of America via a three-phased approach based on the advice of health public experts. These steps will help state and local officials when reopening their economies, getting people back to work, and continuing to protect lives. The criteria for this plan is data-driven. It analyzes and takes into consideration the conditions of each region or state and breaks down the requirements that each should satisfy before proceeding to a phased reopening. It next discusses preparedness and what states should be doing to meet the challenges ahead. And lastly, it provides a phase guideline breakdown of all of the responsibilities of both individuals and employers during all phases of reopening, as well as during each specific phase. Now, before states or regions proceed with a phased opening, there are three considerations that governors of these regions must be satisfying. Those are symptoms, cases, and hospitals. Each state's symptoms must be showing a data-driven downward trajectory of influenza-like illnesses reported within a 14-day period. And they must be showing documented downward trajectory of COVID-like syndromic cases reported in the last 14 days. Each state must also be showing a downward trajectory of documented cases within a 14-day period or a downward trajectory of positive tests as a percent of total tests within a 14-day period. So we're looking at a flat or an increasing volume of tests. Lastly, hospitals. Hospitals must be treating all patients without crisis care, and a robust testing program must be in place for at-risk healthcare workers, including emergency antibody testing. Obviously, for each state, this is going to be dictated by state and local officials, and it will need to be tailored in application to these criteria to local circumstances. So, for example, metropolitan areas that have suffered severe COVID outbreaks versus rural areas and suburban areas where outbreaks have not occurred or have been mild. Also, where appropriate, governors should be working on a regional basis to satisfy these requirements and to progress through the phases, which we will talk about in just a moment. Now, once it has been determined that the state or the region has met the gating criteria, states can begin entering a core state preparedness responsibility phase. Here, states will need to demonstrate their ability to quickly set up safe and efficient screening and testing sites for symptomatic individuals and trace contacts of COVID positive results. Trace contacts are task force, usually of health or military reserve individuals who attempt to follow a positive patient's trial and contact those who may have been exposed to ensure social quarantine and social distancing. Additionally, states must have the ability to test symptomatic or indicated ill persons for COVID and trace contacts of those COVID positive results. Lastly, it needs to be ensured that sentinel surveillance sites are screening for asymptomatic cases and contacts for COVID positive results, and that these are being traced. These would be sites operating in locations serving older individuals, lower income Americans, racial minorities, and Native Americans. Next in this phase is a review of the healthcare system capacity. So you need to have a demonstrated ability to quickly and independently supply sufficient personal protecting equipment, or PPEs, and the critical medical equipment to handle a dramatic surge in need but it must be proven that you have those capabilities, as well as the ability to handle a surge in ICU capacity. Lastly, the state or the region needs documented plans to protect the health and safety of workers in critical industries, like the financial industry. Plans to protect the health and safety of those living and working in high-risk facilities like senior care centers needs to be implemented. You need to show a plan for protecting employees and users of mass transit. The ability to advise citizens regarding protocols for social distancing and face coverings. And then lastly, the ability to monitor conditions and immediately take steps to limit and mitigate any rebounds or outbreaks by restarting a phase or returning to an earlier phase depending on the severity. It is not until then that a state or a region should be considering the proposed phased approach. This is again going to be based on up-to-date data and readiness in the efforts to mitigate risks of resurgence and to protect the most vulnerable within our societies. The goal is to implement this phased approach on a statewide or a county by county basis within each state at the governor's discretion. So always be consulting with your state governor's office, the health department, the Department of Labor, or other governmental or organizational entities in determining what is expected of your state during this phased approach. But with that in mind, it's important to also consider the national standard of this implementation. So during this phased approach, all individuals must be continuing to practice good hygiene. I can't believe that this is already not the new norm and that we have to talk about this, but washing your hands with soap and water or using hand sanitizer, especially after touching frequently used items or surfaces, it must be performed. You want to avoid touching your face. Make sure that you're sneezing or coughing into a tissue or the inside of your elbow, disinfecting regularly and frequently used items and surfaces as much as possible. A best example are cell phones. And at least at the federal level, the White House is urging strongly the use of face coverings while in public, and particularly when using mass transit. Remember, your state or local counties may have stricter requirements, so always pay attention to those. But basically, individuals during this time are expected to adhere to federal, state, and local guidance, as well as the complementary CDC guidance, particularly with respect to face coverings. And in short, if you feel sick, stay at home. Contact and follow the advice of your medical provider. Now, employers during this phased approach have several additional responsibilities to ensure the safety of their staff, as well as the population at large. Employers need to develop and implement appropriate policies, all in accordance with federal, state, and local regulations and guidance that are informed by industry best practices regarding the following: social distancing and protective equipment, temperature checks, testing, isolating and contact tracing, sanitation, the use and disinfection of common and high traffic areas, and lastly, business travel. Employers are now responsible to monitor their workforce for indicative symptoms and should not be allowing symptomatic people to physically return to work until they are cleared by a medical provider. Additionally, employers need to also develop and implement policies and procedures for workforce contact tracing following employee COVID positive tests. But there may be other implications when it comes to this, which we'll be discussing further in our presentation. So we've discussed the expectations of states or regions to begin moving forward to this phased approach, but what does this exactly entail? Granted, always keep in mind this is the national standard and your state or local governments may have additional requirements, so please stay abreast of those. Phase one is for, of course, those states or regions who have satisfied this gating criteria that we just went over. Phase one can be broken down for responsibilities for individuals and then responsibilities for those employers. First, I want to note what the federal government is defining as a vulnerable person here. A vulnerable person is as follows: elderly individuals or individuals with serious underlying health conditions, including high blood pressure, chronic lung disease, diabetes, obesity, asthma, and those whose immune system is compromised, such as by chemotherapy or cancer or other conditions requiring such therapy. So all vulnerable individuals during this first phased approach should be continuing to shelter in place. I know many states are doing this. Washington, where I am, is included. This phase addresses those aspects of daily life for which restrictions remain appropriate due to COVID. Members of households with vulnerable residents must be aware that by returning to work or limited daily activities where distancing is not practical, that you may be carrying the virus back home. Precautions right now need to be considered and may include isolating from vulnerable residents as applicable. Regardless of status, all individuals, when they are in public, such as parks, outdoor recreation areas, shopping centers, the likes, they must be maximizing physical social distancing from others. Social settings of more than 10 during this first phase one, especially where appropriate distancing is not practical, should be avoided unless there are other precautionary measures being observed. One mitigating factor would be a mask, per se. Individuals are supposed to avoid socializing in groups of more than 10 in circumstances that do not readily allow for appropriate social distancing. Receptions, trade shows, concerts, all of those should be, implemented of avoiding that kind of socialization within those states or regions. You should also be minimizing non-essential travel and adhering to your CDC guidelines when it comes to isolation following travel. Employers, on the other hand, during this first phase of the approach, have some additional considerations, more than just those of individuals, and those are predominantly of monitoring for safety. If possible, telework is to be continued to be encouraged whenever possible and feasible within your business operations. And if a return to work is necessary, phases should be in place. Common areas where personnel are likely to congregate and interact should be closed, or at a minimum, an enforced strict social distancing protocol should be in place and disseminated among the employees. Communication and education are going to be key as employers during this particular stage of phase one. Non-essential travel should remain minimized, and you need to be adhering to those CDC's guidelines regarding isolation following travel. And lastly, employers must be considering special accommodations for personnel who are members of a vulnerable population. Phase two are for those states or regions with no evidence of a rebound and those that satisfy the gated criteria a second time as they move forward from phase one. Your governor's office should be dictating this timeline to your state or region, and the time lapse is generally 2-week intervals, but as always, this is a state and a regional specific requirement. For individuals during phase two, again, we have a breakdown of this individuals versus employers' responsibility. All vulnerable individuals should continue to be sheltering in place. Members of households during phase two that have vulnerable residents should be aware that, again, by returning to work or other environments where social distancing cannot be practiced or is not practical, they could be carrying that virus back home. So precautions need to be taken, potentially even isolating from vulnerable residents. All individuals, when in public during phase two, must continue to be maximizing physical distance from others. Social settings of more than 50, where appropriate social distancing would not be practical, must be avoided unless there are precautionary measures that are being observed. And lastly, during phase two, any non-essential travel is permitted to begin to resume. Employers must be continuing to encourage telework whenever possible during phase two and what's feasible, obviously, within your business operations. And you must continue to close common areas where personnel are likely to congregate or interact. In the alternative, employers should enforce moderate social distancing protocols. Non-essential travel, as we know, can resume, but the White House reopening plan continues to have employers strongly consider special accommodations for personnel and a heightened emphasis on those that are members of a vulnerable population. Phase two begins to see specific types of employers with additional allowances to reopen, and that includes, bars, elective surgeries, gyms, large venues, schools. So always pay attention to your surrounding locations requirements. This is going to be very based on your governor's dictation and any county or local requirements that are added in addition to this. And lastly, the White House plan of phase three are for those states or regions with no evidence of a rebound and those that have satisfied the gating criteria again for a third time. Most states are working their way to a phase three. No one is currently at this level yet or should be. Vulnerable individuals during phase three may resume public interaction, but should still be practicing social distancing, minimizing their exposure to social settings where distancing is not practical unless precautionary measures are being observed. So low-risk populations are going to be continuing to minimize their time spent in crowded environments during this phase three, and employers during phase three are permitted to resume unrestricted staffing of work sites. So we've covered a breakdown of what the federal guidelines are of the White House reopening plan when it comes to reopening up America again. But what does that mean specifically for the financial industry? What is the new norm that we can come to expect when it comes to banking, reopening or extending operations within branches, serving the needs of not only our customers, but our employees when it comes to safety and health, and reestablishing this business as normal mentality in a world that is likely never going to be the same? First, I want to point out the key considerations that banks should be following for guidance on reopening. Financial institutions must be incorporating and reviewing the requirements of these organizations' various guidance with the ultimate goal in mind of having a safe work environment for customers and employees alike. Banks need to have a proactive approach rather than a reactive, and flexibility coupled with preparedness is going to be key. I have included the links here for the CDC, OSHA, EEOC, Department of Homeland Security, the World Health Organization, Department of Labor, and then lastly, the Families First Coronavirus Response Act, or the FFCRA. On top of this, though, banks should also be following your state and local guidance. And lastly, do not forget about your bank policy. Your bank policy should be assisting you in your next steps and your determination of priorities. So before I move into a deep dive, there are some questions that I want to pose to have you think about as we move forward in our understanding of the various requirements when it comes to reopening branches. We are hearing through the press a lot about restarting the economy and allowing businesses that were previously closed during the pandemic to reopen during this ongoing public health emergency. This includes permitting non-essential workers to return to work, but there are precautions to this. And while we were all eager to return back to normal, we cannot be flinging open doors and allowing employees to return to work without restrictions or precautions. The normal will not, at least for the foreseeable future, be the same at this point. And banks in particular have to adapt and adjust as essential enterprises for the American economy. You have adapted your branches and your processes into limited accessibility and work from home protocols. You have increased work from home policies and have encouraged more online banking with your customers. But as the need arises for branches to have inside foot traffic again, what are the considerations that banks should be taking in? So with the changes from stay-at-home orders beginning to roll out, there are many practical questions that banks need to start thinking about in order to begin preparing a reopening phase for your branches or extending of the operations that you already currently have offered, in order to create that safe environment once branch employees and customers begin to return. The first question I want to call is what is going to be required to physically reopen your branches or expand branch services? Most, if not all, banks have temporarily closed branches or limited branch operations, such as limiting customers to drive-through access only or requiring customers to make appointments to be able to enter the branch. But it is critical as we begin to reopen the banks that we are identifying areas of business that are most in need of physical access to a branch to ensure prioritization. What are the temporary measures that need to remain in place, if any, once state and local directives are revised or lifted? Should you continue to limit customers to drive-through access for certain transactions? Should your bank lobbies reopen? And if so, what is the number of customers that should be allowed in at any one time? Who should be determining and enforcing this limitation? Practicality and a checklist mentality needs to occur in order to prepare for these reopenings. A second question to keep in mind is, what will the process of employees returning to work look like? Banks then need to be considering how you are going to return employees to work. This process is obviously going to vary on a bank by bank and a branch by branch basis, as there is no one cookie cutter answer, unfortunately. First, you must determine who actually will be returning to the workplace and when. Who and how may need to be physically present in the workplace to do their jobs. So here we're thinking about tellers, loan officers, branch security. We need to be contemplating returning employees to the workplace in waves or stages. And what that means is potentially prioritizing those who must physically be present versus those who continue to work remotely. But productivity is key. Who can work remotely, or what is the minimum number of in-branch staff that is needed to maintain or increase productivity while still not drastically increasing the number of employees in the workspace. What are the typical employee hours for work going to be? Do any changes need to be made there for schedules or work times to assist with social distancing and a safe rollout? Maybe you have different groups of employees in the office on different days. Management level employees could continue to work at home and come in only one day a week, but ultimately here, the goal is to be reducing branch capacity and the potential exposure for COVID-19. A third question are what precautions must be taken to keep workplace safe once employees and customers are beginning to return. And we know, again, the goal of the plan is to keep the workplace safe once branch employees and customers are returning. But as an employer, you need to be proactive in mitigating risk of exposing not only employees, but customers to infection and creating a second wave of COVID-19. Regardless of who is determined within your organization as essential or non-essential when it comes to physically being back in the branches, you must be developing and preparing to enforce social distancing plans and other preventative measures. Do any physical modifications need to be made to the workplace? As we heard earlier, for tellers, this could include, extending partitions upwards between stations, leaving every other station empty, building out stations to create more distance between tellers and customers, or putting in those clear shields at each station. For lobbies, you could physically rearrange to create less of an area for people to linger and to rethink where and how customers can complete deposit and withdrawal slips at your branch. You could reposition desks, create some kind of additional cubicle space between people, and you can close conference rooms. And while I know in some areas supplies are still limited, it is important to make sure that you are stocking up on proper supplies like cleaning products, hand sanitizer, disinfectant that can be used by both customers and employees alike. So let's face it, you work in an area where there is just a sheer number of high touch surfaces. So there will be a lot of areas to sanitize throughout the day. A fourth consideration is how and who at the bank will stay abreast of applicable guidance. So like with our previous slide, you are going to want to make sure that as the employer, you are up to speed on the Centers for Disease Control and the Prevention and Occupational Safety and Health Administration guidelines when it comes to the workplace, as well as other considerations. And you want to make sure that you are effectively communicating that to your employees. You always want to be checking with state and local directives on who has to wear a mask, when, and where. Some states are requiring employees who have contact with the public to wear a mask, while others have more or less stringent requirements. Others have no requirements at all. So to add another layer of this complexity, some cities have their own requirements separate and more intensive than the state at large. So you want to make sure that you are ensuring that you are following all applicable rules on safety and which are being regularly revised. And so who at your organization is going to be staying on top of this? Now, a fifth consideration are what communications will be needed and how frequent will those be needed to employees as well as your customers. As much as we want the normal, employees and customers need to be made aware and understand that the workplace and the branches are not going to look or operate in the same way that they did prior to the pandemic. We want to start developing messages about the return to work process for your employees, as well as developing information for customers about branch reopening protocols and expectations. Signage, radio announcements, social media campaigns, all can begin informing customers of the expectations when it comes to banking in branch, as well as interacting with tellers. If you didn't have a drive-through service open during the pandemic and you're planning to reopen this operation, you also need to be thinking about the process, such as cleaning of canisters and items exchanged, in order to ensure both the customer and the employee are comfortable and safe. And lastly, our sixth consideration is, does a review of the pandemic plan and the success of its implementation impact or alter the bank's next steps when it comes to reopening or enhancing of services? Before the stay-at-home order was in place, banks and society in general were completely reactive. As we move out of the stay-at-home and back into society, we need to be reflecting on what processes you have in place and how those need to change or develop based on the needs of employees returning back to work. Now is the time to develop or to fine-tune solid procedures for tracking and reporting illness, as well as a plan for reporting workplace safety issues, such as a coworker who isn't practicing social distancing. What are your leave policies? And does anything need to temporarily be revised for childcare considerations, transportation limitations, or the like? You want to make sure that you have a process for employees to request accommodations that is both sensitive but effective. Looking backwards will assist us with moving forwards. So, what are the physical considerations when it comes to reopening branches? And there are two areas of concern, obviously, customer considerations and staff and location oversight and management. You want to be limiting the number of customers that are permitted into your building. You want notifications that are informing of self-monitoring and or enforcement protocols for entry so that customers know what is expected of them upon entering. You want social distancing markers, physical barriers that are protecting customers and employees, like the teller window. And you have to be considering airflow direction considerations and HVAC filtration for clean, movable, circulating air. When's the last time that you've dusted your air vents? All employers should be implementing and updating as necessary a plan that is specific for your workplace, identifies all areas and job tasks with potential exposure to COVID-19, as well as including control measures to eliminate or reduce such exposures. Banks need to be reminding customers that the CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, especially in areas of significant community-based transmission. But just because a face cover is on, it does not replace the need to social distance. Assess your essential functions and the reliance that others in the community has on your services or products. You want to make sure that you are prepared to change your business practices if needed to maintain those critical operations. For staff and location management oversight, you want to establish those policies and practices for social distancing. So altering your workspace to help workers and customers maintain that social distancing is paramount. And you want to be able to physically separate employees from each other and from customers when it's possible. So some strategies that businesses could use for this are again, implementing that flexible work site or a work from home protocol, flexible work hours where you're rotating or staggering shifts to limit the number of employees in the workplace at the same time. You want to make sure that you're increasing the physical space between employees at the worksite by modifying the workspace itself. That's increasing physical space between employees and customers, a drive-through service, physical barriers such as those partitions. You want to have signs, tape markers, other visual clues such as decals or colored tape on the floor that are that 6 feet apart distance. And it's indicating for people of where they are supposed to stand when physical barriers are not possible. You also want to make sure that you're following protocols, keeping in mind that people may have disabilities, sight or vision being one of them. How are you going to assist them safely, both for their safety and your staff's safety, in assisting for in-branch transactions? So, do you have the capability for someone at the door to be assisting customers, to be reiterating all of what the signs and the markers are stating when it comes to social distancing and the expectations of having customers return to your branch? You may also want to implement flexible meeting or travel options, so postponing any non-essential meetings, doing them virtually. And again, all of that is in accordance with your state and local regulations and guidance. It's very important that you close or that you limit access to common areas where employees are likely to congregate and interact. Prohibit handshaking. This is okay at this time. It is not rude. You want to make sure that you have a voiced policy when it comes to physical touch or interaction between not only your employees, but also your customers. Can you deliver more services remotely, offering more phone or video chat options for customers rather than coming in branch? So basically, you want to be adjusting your practices to reduce close contact between employees as well as employees and the customers. So providing drive-through services, something similar to a curbside service even. You can get creative with this when it comes to the social distancing and the expectations for your business locations. And obviously, you have to think logistically. If you have more than one branch, which most of you or all of you do, you need to consider giving those branch managers individually the authority to take appropriate actions that are outlined within your COVID-19 response plans as it is based on their particular condition. Effectiveness, speed, and consistency are all going to be key. The CDC does have guidance on businesses and employees for planning, preparing, and responding to the coronavirus disease, and those are being updated constantly. Additionally, OSHA has guidance on preparing workplaces for COVID-19 that address the use of facilities. It establishes a lower, a medium, and a higher exposure risk gradient rating and what to do to protect employees depending upon what category they fall into. Banks are likely going to see a medium or a lower exposure risk rating off those OSHA scales for your employees. So based on the degree, the bank needs to be considering administrative controls that are in place to protect your workers. So what are the sanitation and the cleaning procedures that need to be in place? And there is still so much to learn about the coronavirus and what actually causes COVID-19. It's based off of the SARS virus. And so what we currently know about the virus and other similar coronaviruses is that, it's caused by SARS. It's spread from person to person. It happens most frequently among close contact. Within that 6 feet barrier range. And this type of transmission occurs via respiratory droplets. But disease transmission can also be infectious from other elements that are still uncertain and being dictated to us, in measures as we learn more about what's going on with this pandemic. So it's unknown, for example, of how long the air inside a room that was occupied by someone with confirmed COVID-19 remains potentially infectious. So you want to be considering within your facilities factors such as the size of the room, the ventilation system design, and that's including the airflow rate and the location of supply and exhaust vents. And you want to be deciding how long to close off rooms or areas where potentially ill persons could have been present before you even begin disinfecting. You want to be taking measures to provide and improve the ventilation in any area or room where someone was ill or suspected to be ill with COVID-19, because that will help shorten the time it takes for the respiratory droplets to be removed from the air. So you want to be working with your local and your state health departments to ensure the appropriate local protocols and guidelines are in place. And that could be updating or adding additional guidance for cleaning and disinfecting. You want to make sure that those are being followed, including the identification of new potential COVID cases within your regions. You want to make sure that as the employer, you are educating your staff and your workers before and while they are performing this cleaning. Laundry is very important. Trash pickup activities. You want to make sure that you are recognizing and have educated your staff to recognize the symptoms of COVID-19. And you want to provide instructions on what to do if they develop symptoms within 14 days after their last possible exposure to the virus. So at a minimum, any staff should immediately notify their supervisor and the local health department if they develop symptoms of COVID-19. And the health department will provide the guidance on what actions need to be taken. You want to make sure that you're developing policies for worker protection and that you're providing training to all cleaning staff on site that are providing your cleaning services. And training should include how and when to use PPE, what PPE is necessary, how to properly put it on, how to use, take off, how to dispose of. You want to make sure that your cleaning professionals are trained on the hazards of cleaning chemicals that are used within the workplace, as well as your employees. And all of that is in accordance to OSHA's hazard communication standard. And you want to be complying with OSHA's standards for bloodborne pathogens. And all of that, again, is going to include guidance on the proper disposal of regulated waste, of PPEs, and the like. You want to make sure, too, that your cleaning staff is bonded and insured, that they are fully vetted, and they're able to clean and disinfect all areas of the office, bathrooms, common areas, shared electronic equipment, remote controls, ATM machines, keyboards, screens, things that are used by everyone, not only ill persons. And you want to make sure that they're focusing on those frequently touched surfaces. The risk of exposure to cleaning staff is inherently low, but they still should be wearing disposable gloves, gowns if necessary for all tasks in the cleaning process, including the handling of trash. They want to make sure that they're removing their gloves after cleaning a room or an area that's been occupied, and that those are disposed of appropriately. And when the bank is going to begin reopening branches, you need to have a timing and a location of cleaning and disinfection of surfaces based on whether they're hard, porous, electronic, or other. The Environmental Protection Agency does have a website for disinfectants that can be used against SARS-CoV-2, which is the precursor to COVID-19, which causes that COVID-19 virus. And it's important that you are kept abreast of what cleaning products are being used, whether they're effective at killing the virus that can produce COVID-19, as well as the safety measures that's required when using those products, whether or not they're safe on humans, surfaces, both. So there's a lot to consider when it comes to sanitation. Next are the requirements for PPE. What are those requirements for the bank? Who should be providing them? Now, the CDC recommends wearing those cloth face coverings in public settings where other social distancing measures are difficult to maintain, especially in areas of significant community transmission. Now, these cloth face coverings may prevent people who don't know they have the virus from transmitting it to others. But they're not surgical masks, they're not respirators, and they're not appropriate substitutes for when in workplaces social distancing is available and readily feasible within your location itself. And they're not substitutes for the masks or respirators that may be required or recommended. Employees should continue to follow your routine policies and procedures on PPEs that are specific to your locations, if any, if you have any policies and procedures on this. And it would be based off what people ordinarily do for their job tasks. You want to make sure, of course, that when anyone is ever cleaning or disinfecting, that the employees are wearing gloves or appropriate materials for the chemicals being used. The CDC does not recommend the use of PPE in workplaces where it's not routinely recommended. Financial institutions are not hospitals, so it's not an area where the CDC is demanding or recommending that these be routinely used. Facilities will be using a hierarchy of controls, such as administrative, engineering controls, and these strategies are even more effective than at preventing the exposures to COVID-19, and they're oftentimes more effective than the PPEs. The EEOC does enforce workplace anti-discrimination laws, which includes the Americans with Disabilities Act and their Rehabilitation Act, and that talks about the requirement for reasonable accommodation and the rules about medical examinations and inquiries. So the ADA and the Rehabilitation Act rules continue to apply, but they do not interfere with or prevent employers from following the guidelines and suggestions that are made by the CDC about steps that employers should take regarding coronavirus. The EEOC has provided guidance that is consistent with workplace protections and rules that can help employers implement strategies to navigate the impact of COVID in the workplace. The EEOC guidance identifies relevant established ADA and Rehabilitation Act principles and answers questions that are frequently asked about workplace environments during COVID-like events. Ultimately, banks need to be developing policies and procedures for the wearing of PPEs, a hierarchy of control and commands for the expectations and when those are applicable. And you have to be keeping in mind the ECOA and the ADA accommodations requirements. And you want to be thinking about trainings and other dissemination of information that's surrounding masks, face coverings, disposals of PPE, etc. Banks per OSHA must be providing PPEs for customer-facing employees, and you have to be assuming the costs. Employers have a responsibility to protect employees from workplace hazards that can cause injury or illness. Controlling a hazard at its source is the best way to protect workers. However, when you're practicing social distancing, administrative controls, where those may not be feasible or your location doesn't permit that 6 feet distance, you should be providing personal protection equipment to employees, in the workspace that are not customer facing, just to make sure that you are protecting through OSHA's requirements your employees from the coronavirus and the pandemic. The final rule does not create new requirements regarding what PPEs employers must be providing. It just states that employers cannot require customers that are facing employees that are customer facing. You cannot require that they be providing their own PPEs. And it's very important to make sure, back office staff, that those are generally as dictated by OSHA, they're low risk, so additional PPEs or face coverings may not necessarily be required. But it's important for the bank to determine the policy of what it's going to be for purchasing and providing facial equipment and coverings for not only those staff that is customer facing, but also the considerations when it comes to back office employees as well. Now, medical screenings are a key concern for reopening of branches, and that's both for customers and employees. Screening employees is an optional strategy that employers may use. There are several methods that employers can use to protect the employee conducting a temperature screening. The most protective methods incorporate the social distancing. Can you maintain 6 feet from others? Physical barriers that are eliminating or minimizing the screener's exposure due to that close contact with a person who has symptoms during screening. So there are different examples that can be provided on, of course, the CDC's website that's talking about methods of a safe physical screening if that is something that your financial institution would like to implement. If social distancing or barrier controls can't be implemented during screening, PPPs are an option, or PPEs are an option. But the reliance on a PPE alone is less effective when it comes to controlling, and it's more difficult to implement given the PPE shortages and the training requirements that come with it. You are not required, and you should not be requiring sick employees to provide a COVID-19 test result or a healthcare provider's note to validate their illness, to qualify for sick leave, or to return to work. Healthcare provider offices and medical facilities may be extremely busy, and they're not able to provide such documentation in a timely manner. But you want to make sure that you're having conversations with employees if they are expressing concerns. Some people may be at a higher risk of severe illness. It includes obviously older adults, 65 and older, people of any age that have a serious underlying medical condition. So by using strategies that help prevent the spread of COVID-19 in the workplace, you will help protect all employees, including those that are at a higher risk. And again, some strategies for that: implementing telework and other social distancing practices, actively encouraging employees to stay home when they're sick, promoting hand washing, providing supplies and appropriate PPEs for cleaning and disinfecting workspaces. But in workplaces where it's not possible to eliminate face-to-face contact, such as the teller line, you need to consider assigning higher risk employees work tasks that allow them to maintain a 6-foot distance from others if it's feasible. Training obviously is going to be very important, having that open communication with your employees, discussions and signage about disposal and safety information for your employees. And you want to make sure, again, per ADA mandate, that you are keeping any medical information, which can include a medical screening, either done solely by the employee or if it's something that you do in branch, that those are being kept separate from personnel files. It's very important that you discuss this with your legal counsel, an HR representative who has a solid understanding of what the applicable ADA and Rehabilitation Act guidelines are when it comes to performing medical screening and the results of those medical information and personnel files in general. Now, entry logging is an interesting element when you're considering reopening of a branch. There's no federal guidance on entry logging. There may be at a state or local level, so that's important to consider. But a lot of this would coincide with contact tracing. Some states may be requiring identification to enter public spaces as a best practice to keep track of the potential spread of a virus. So how banks respond to logging of employees, customers, vendors, service providers, all of that is going to depend on your individual state and county mandates, as well as your own personal assessment of risk. You just want to make sure that cautions are being taken if identification is being collected for privacy and security purposes as well. Now, testing availability and requirements are also dependent on where you were located and what guidance state and local requirements are in place. So the CDC has in place guidance on how to decide if a viral test is of the best interest of an individual and the general public. Not everyone needs to be tested for COVID-19. So again, refer to the CDC. The CDC has guidance for who should be tested. But decisions about testing are made by state and local departments or healthcare providers. Bank employees should fall generally under a priority for testing only if they're exhibiting symptoms of potential COVID-19 infection, which include fever, cough, shortness of breath, chills, muscle pain, loss of taste or smell, sore throat, etc. So persons without symptoms who are prioritized by the health department or a doctor for any reason, it is applicable, and it includes but not limited to public health monitoring, surveillance, screening for other asymptomatic individuals. All of this is dictated by state and local plans. The bank is not the one to be making that decision. If an employee does, test positive for COVID, per the CDC, there is currently no requirement for the employee to notify the employer, but they are required to notify the state or local health department. So per the EEOC as well, there is also no requirement that the employee notify the employer, but a state's employer can inquire about the employee's symptoms and take the employee's body temperature. Generally, measuring an employee's body temperature is a medical examination, but because of pandemic influenza symptoms, it is appropriate then, per the CDC and health authorities, that employers can measure an employee's body temperature. But you need to be aware, that people with just even the common flu, but COVID-19, they may not have a fever. So it is only one protocol that can be in place to help kind of detect and prevent the curve of an uptick when it comes to the COVID-19. Because the CDC and state and local health authorities have acknowledged the community spread of COVID-19, they've issued precautions as early as March. You want to make sure that as an employer, you're measuring the employee's body temperature, but you have policies and procedures that dictate this. You want to make sure that there is the right kind of protocols and the avenues for what this information is, what information exactly is being collected on your employees, that you're keeping with that ADA confidentiality requirement, and that there is appropriate chain of command, notification, and destruction of what these records are when it comes to testing and taking an employee's temperature when they enter a building. You're free to have a policy in place that requires employees to notify you of a positive test as part of their medical screening program, but you, of course, again, need to be considering those ADA confidentiality concerns. There's currently no known guidance when it comes on antibody testing, immunity passports. Nothing from the CDC has been issued on this, just because these test results alone do not actually confirm if the individual is able to spread the virus that causes COVID-19. This is something to keep on your radar. It could be applicable in the future as a way to kind of remedy out from these periodic medical tests of temperature. But at this time, there's no specific guidance from the CDC when it comes to antibody testing or immunity passports. So what procedures do you need to have in place if an employee or customer tests positive? Employees who have symptoms when they arrive at work or become sick during the day should immediately be separated from other employees, customers, as well as visitors, and they need to be sent home. Employees who develop symptoms outside of work should notify their supervisor and stay home as well. Sick employees need to be following the CDC recommended steps. That information you should be making readily available. Again, communication is going to be key. Education is going to be key during this time with your employees. And you want to make sure that employees are not returning to work until they have met the criteria to discontinue home isolation, and that they have consulted with a healthcare provider and state or local health department. So in most cases, you would not need to shut down your facility, but you would want to close off any areas used for prolonged periods of time by the sick person. That's generally a requirement to wait 24 hours before cleaning and disinfecting to minimize the potential for other employees being exposed. If waiting 24 hours is not feasible, you are expected to wait as long as possible. And during this waiting period, you want to make sure that you are opening doors and windows to increase air circulation in these areas. And you also want to be following the CDC's cleaning and disinfection recommendations. So it's very important, again, if there is the need for personal protective equipment, the disposal of all the cleaning tools and products, wearing of gloves, that education is being given to not only your employees, but your cleaning staff as well. And in addition to cleaning and disinfecting, you should be determining which employees may have been exposed to the virus and take additional precautions from there. Sick employees, again, you want to make sure they're following those CDC recommended steps. And to ensure the continuity of your operations, particularly when it comes to essential functions, you want to make sure that you are advising your staff on who are critical infrastructure workers and whether or not they can be internal, in branch, external, working telecommuting. And you want to make sure that you're providing them symptom-free and additional precautions to protect them and not only the community at large. Now, when it comes to if sick employees, are they following those preventative steps when it comes to COVID-19 and helping prevent the spread? You do want to monitor and make sure that you have a policy in place about not being able to return to work until they meet the criteria to discontinue home isolation. And you always want to make sure that they have consulted with their healthcare provider and any state or local health departments. There's currently no guidance when it comes from the CDC on if customers, vendors, service providers, if any of those test positive and have come into your branch, it would be up to your bank's policies and procedures on how to respond and how to determine how to respond. But at this time, there's no official guidance. Obviously, you would want to be taking the same kind of precautions when it comes to cleaning and a healthy ventilation of possible infected areas. Now, you should not be requiring sick employees to provide a negative COVID-19 test result or healthcare provider's note to return to work. This is very important. Employees with COVID-19 who have stayed home can stop home isolation and return to work when they have met one of the following sets of criteria. Option one is if in consultation, of course, with their healthcare provider and local public health authorities, if it's determined that an employee will not have a test to determine if they are contagious, and this is, again, is mandated by the healthcare provider or the local healthcare authority, if it's determined that they will not need a test, the employee can leave home and return to work after 3 conditions are met. They had to have not had a fever for at least 72 hours, and they had to have improvement when it comes to any respiratory symptoms, so coughing, shortness of breath, as well as they had to have at least 10 days passed since their symptoms first appeared. The other option is that if, of course, in consult with a healthcare provider, it's determined that the employee must be tested to determine if the employee is still contagious, the employee can leave home if they are no longer with fever, they have improved respiratory symptoms, and they have had 2 negative tests in a row, at least 24 hours apart. And their doctor is the one that is following those CDC requirements when it comes to the guidelines for testing. Now, recovered person procedural considerations. You want to make sure that you have documentation. Is there a retesting schedule that may be applicable? Are they allowed to be able to return to work? What kind of functions are they allowed to perform? Does it need to change within your institutions? So all of the procedural considerations, as well as accommodations for vulnerable persons, as well as ADA requirements, all of that needs to be factored into a person coming back into the workplace. Again, masks are a consideration, that social distancing, whether or not if they are returning to work, can they work remotely even longer, just to kind of assess the situation and make sure that they're protected as well as your employees. You want to make sure that that is communicated to your employees. They know the protocols that they need to be taking to return to work safely, and that they're educated on what the expectations are, and you have a chain of command for approval or special considerations that may come into play. Now, bank security concerns are a big issue within your organizations. You want to make sure that when customers are coming in, that you know your customer. People are going to be wearing cloth face coverings, masks, and you want to consider the potential that robberies may take place. It's okay to have procedures, and again, this is where education and communication with bank customers comes into play. Is you want to make sure that you have a procedure in place of if someone is within 6 feet of a teller line, you may ask them to quickly remove their mask so you can see their face for the camera. You can have procedures that state, that can be done at the door. There's a screening process at the door. But all of this, you want to make sure is effectively being communicated to customers. Obviously, everyone is very hesitant and cognizant when they go out of potential expectations, but communicating that, at least in the foreseeable future, of what the bank may be requiring when it comes to entering your facilities, potentially wearing a face covering, having that policy dictated not only within your organization, but also to the public at large is going to be very crucial. You want to make sure, again, that from a physical security standpoint, whether or not a guard at your door may be required, whether or not you need to re-review or retrain employees when it comes to robbery scenarios, and how to train those and retrain your lobby employees when it comes to matters of your robbery procedures, notifying the police authorities, and just making sure that, if a threat does go through, do you have the proper training in place for your individuals? People are going to be entering banks with masks, and we just need to be considering what the impact is of that. So outside the bank's walls of preparedness, how are banks going to be responding to the scenario as we move forward? And so it's very important to remember, how are banks responding to the long-term work from home scenario? Workman's compensation is something that you need to be considering, especially if an employee contracts COVID-19, and they're trying to prove that they got it at work. These are obviously going to be a state-by-state basis. You always want to be contacting legal counsel when applicable, but you want to be checking your bank's insurance policies and state and local requirements when claims are involved. There's different protocols on how to handle workman's comp claims if it ever does happen at your business or if it's happening at their home. Employers, as a financial institution, you need to be making sure that your IT and your office provisioning for remote work environments are appropriate to the expectations from an information security and an IT standpoint. So you have the bandwidth to be able to keep continued support of these work from home scenarios. What if an employee is suffering from lack of child care, elder care, family care? You also want to be consulting your HR professionals and other labor law attorneys when it comes to Families First Coronavirus Response Act requirements, and then how to be accommodating for assisting families that are in need of care. Again, communication is going to be crucial, and you want to make sure that you're offering flexible hour arrangements or FMLA applicability. Are you reviewing your CARES Act leave requirements? And are you having and leaving open a door of dialogue and discussion, as well as a known chain of command for people that are experiencing or suffering lack of childcare or in need of assistance when it comes to even transportation? Are employees struggling to find transportation? As critical workers, mass transit options may be limited. And so how are they going to be getting to your branches? Is there a way that you can assist them when it comes to transportation that is both effective but also safe for everyone that's involved? What are employees going to be doing with travel considerations? Have you reopened travel or will be reopened traveling when you've reached the appropriate phase within your institutions? And what restrictions will be in place? Who is going to be allowed to travel? All of these need to be taken into consideration. You want to have them documented. And again, communication and a chain of command on who is going to be making those decisions or any exceptions that come with it. Now, there are other considerations within COVID-19 as we move forward and prepare. And it's very important to make sure that you are developing, you're reviewing, and you're re-reviewing your post-COVID-19 strategy. It's important that when you're looking at the retail banking's future post a pandemic, you want to have a short-term and a long-term plan. What is going to be your branch distribution? What are your internal operations going to look like? Do any customer service enhancements need to be made? Of course, under the guise of sound business decisions. Do you need to reset your branch revenue outlook? Branch optimization is on the table now. How are your branches going to be affected moving forward in a post-pandemic world? And do you need to change the expectations of what retail banking is going to look like? Is there going to be a sustained increase on the use of technology in banking and customer service? Marketing is also going to be a large consideration, especially during a time of economic crisis. A retooling of your marketing, your platform, your strategy, and how you're effectively giving information to customers is going to be important. And you want to have information with a heart. You want to make sure that you are actually assisting your communities and not placing them in more of an economic financial burden at this point. You want to focus on your business continuity planning and refocus on it. Does anything need to change? And you want to consider the trimming of costs. So it's very important, again, that you are being proactive rather than reactive. You want to be developing, reviewing, and re-reviewing any post-COVID-19 strategies. Now, this concludes our presentation for today. I want to thank you so much for joining me. Please review your manual, our tools that we've provided, as well as Compliance Alliance's webpage for additional guidance, comments, tools, resources, all for both COVID-19 as well as PPP lending. And if you do have any questions after today's session, please add them to our chat feature and we can get those addressed for you. Thank you so much, and I hope you all have a wonderful afternoon.